This video is provided for the seeing impaired and those individuals who prefer an audio and visual presentation.
Hello, I'm Dr. Tyndall and I would like you to imagine we are traveling back through time somewhere between 1946 and 1964. Now let's follow the average life of perhaps 80% of the American population from that time period and see how their health changed over time. Stage 1. Birth to the age of 13. In the early years we see these children are playing all day without a care in the world. They apparently don't know about sickness, except maybe for their grandmother or grandfather, who doesn't seem to move around very fast. They are eating pretty well during these years. Their parents make them eat fruits and vegetables almost every day. But sometimes, their mom and dad takes them out to eat some fast food, which we now call junk food for a better term. You know what I mean, a hamburger, fries and a Coke. They sleep really good most of the time, unless someone lets them watch a scary movie and then they get scared and have a nightmare or they get an upset stomach from that junk food they ate. But morning comes and their stomachache is gone and they are out there having a great time playing again all day. They never seem to get sore, or if they fall and get hurt from playing, they seem to be alright after just a little bit of time. They seem to heal quickly. It's like they didn't get hurt at all. They really don't seem to have any stress. They can play all day and well into the evenings and never seem to get tired. They can eat a lot of junk food that adults can't without the problems that their parents get from eating too much of that stuff, and they take what we now call power naps and are fully refreshed in just a short time. Amazing, how are they doing this? Stage 2. 13 to 27 years old. As these young children start to mature into young ladies and young men, we see many of their childhood traits still apparent during this time, but on a larger scale. They play about the same or perhaps even for longer time period, before they need sleep. Their playtime, and if they are working, seems more intense on their bodies and minds, but they don't appear to be any worse for wear after playing, yet they seem to get more pain, soreness and starting to experience more stress. But, it appears that they take a little longer to heal, but that maybe that is from the intenseness of their activities, which was not necessarily the case when they were younger. How are they accomplishing this? Is it really possible that death begins at 27? In stage 3. 27 to 35 years old. Something seems to be changing as we watch these adults during this time period of their lives. It appears their life force is being drained, some more than others. Their bodies and minds seem to be experiencing a great deal of stress. They are developing signs of sickness. Their adult bodies are not recovering from injuries and accidents like they did in the earlier years. Some of the people at this stage of life are reaching a life-threatening level requiring major radical medical intervention, such as surgeries to remove vital organs, having to take medications, which are causing even more problems for some of them to survive. There are some in this age group, which although are a small percentage, are dying from diseases affecting major internal organs and system shutdowns. Luckily the majority of the people in this stage of their life have not yet shown any life-threatening conditions, but the health level does definitely indicate the quality of health experienced at this stage of their life is truly less than their previous stages. The majority of these people, even though do not have symptoms of major disease, are beginning to slow down in their movements. They can't seem to handle all the different foods they used to all the time now. They experience more tiredness and require more downtime to repair from their daily little injuries than they used to. It appears that they are being attacked by unseen external and internal forces that are causing them health problems. We also see that they all are exhibiting a downhill turn regarding health and happiness than before this time in their life. What went wrong? What is missing? Stage 4. 35 to 65 years old. We can see that it is the majority rather than minority in this adult stage, who are now experiencing the more intense aches and pains, serious illness. They are taking more and more drugs to cover up the symptoms of the body's dysfunction. They are truly losing the battle in combating disease and restoring health and balance to the body. What did stage 1 and 2 have, that stage 3 and 4 does not? Stage 5. 65 years old and beyond. The golden years. We can overhear some of the people who have reached this stage of life saying, "If these are my golden years, they must be made from fool's gold." These adult seniors remember being promised that science was working for them to make it a better world for them to live in. That if they worked hard, they would be rewarded, and they were told that they had the best healthcare system in the world. They were also told that people were living longer. But, they weren't told that the quality of those extra years would only be possible if they took lots of drugs and were living like zombies in some nursing home. Sure, science has helped them, just ask the drug companies. How many diseases have truthfully been cured with drugs and modern medicines? Organizations like the Quack Watch, which is funded by you-know-who, attacks all healthcare that does not follow the drug and established medical business approach. The medical propaganda of, if you can survive 5 years, you will be considered cured. What they don't tell you is how many of those cured people that start dying from that disease they were cured from after 5 years and 1 day. Do they? There are more sick people now per population and more drugs prescribed per patient than ever before, yet we are a sicker society than at any other time in history. Why? This age group wanted to believe if they took a drug for pain they were fine. Having surgery that remove a vital organ would be good for their health, and the scars that were left would be no big deal and they would live happy ever after. Most of them are spending their social security on medicines now, just to stay alive a little longer. They weren't told in the earlier stages of their lives that the traditional healthcare that they would be getting in their future would possibly give them serious side effects or would take all their money to try to resolve their health problems as they got older. They believed what the doctors and the drug advertisements wanted them to believe, and look at them now. Look at your parents and grandparents, and think, is this what you are going to go through when you reach your golden years? Baby boomers are a special group of people. They are starting to ask questions about the healthcare system and want to know if there are other alternatives to surgery and drugs for most health conditions that work with no possible side effects. But, on the positive side of modern orthodox medicine, it has its place, and that is, we Americans have the best diagnostic services in the world. We are also provided with some of the best emergency life crisis care. But, I personally don't want to have my wife or me to ever need emergency life crisis care, do you? Masking symptoms are at best a quick patch job, but never a lasting answer to a health problem. Now, would you like to know what you need to do, so you will have a better chance than your parents and grandparents did?
What are systemic enzymes and what do they do?
Systemic enzymes are those that operate not just for digestion, but also throughout your body in every system and organ. An enzyme is a biocatalyst that is something that makes something else work or work faster. Chemical reactions are generally slow things, enzymes speed them up. Without enzymes, the chemical reactions that make up our life would be too slow for life, as we know it. For life to manifest, as we know it, enzymes are essential to speed up the reactions. We have roughly some 3,000 enzymes in our bodies, and that results in over 7,000 enzymic reactions. First and foremost, these body-wide proteolytic enzymes, meaning protein eaters, have the following actions: natural anti-inflammatory. Enzymes are the first line of defense against inflammation. Inflammation is a reaction by the immune system to an irritation. Let's say you have an injured right knee. Aspirin, ibuprofen, Celebrex, Vioxx and the rest of the non-steroidal anti-inflammatory drugs all work by keeping the body from making all CICs. This ignores the fact that some CICs are vital to life, like those that maintain the lining of the intestine and those that keep the kidneys functioning. Not to mention the fact that the NSAIDs, along with acetaminophen, are highly toxic to the liver. Every year 20,000 Americans die from these over-the-counter drugs, and another 100,000 will wind up in the hospital with liver damage, kidney damage or bleeding intestines from the side effects of these drugs. Anti-fibrosis. Enzymes eat scar tissue and fibrosis. Fibrosis is scar tissue, and most doctors learn in anatomy that it is fibrosis that eventually kills us all. As we age, at about 27, we have a diminishing of the body's output of enzymes. This is because we make a finite amount of enzymes in a lifetime, and we use up a good deal of them by the time we are 27. At that point, the body knows that if it keeps up that rate of consumption, we'll run out of enzymes and be dead by the time we reach our 40s. So our body in its wisdom begins to dole out our enzymes with an eyedropper instead of with a tablespoon. As a result, the repair mechanism of the body goes out of balance. This is why as we age, our wounds heal with thicker, less pliable, weaker and very visible scars. If we replace the lost enzymes, we can help control and reduce the amount of scar tissue and fibrosis our bodies have.
Would you like further information regarding systemic enzymes? Call Patty at World Nutrition. She is Dr. Tyndall's nutritional consultant, and she will be happy to answer any of your questions. 1-800-548-2710, extension 149. That's 1-800-548-2710, extension 149.
Please understand, these products are only available through World Nutrition and healthcare professionals, so when you talk to Patty, tell her, Dr. Tyndall referred you.